Good afternoon, Sheryl, and welcome to the podcast. This is going to be an interesting show today, as it's something that's definitely new for us in any case. Of course, we've talked about diagnostics and biomarkers and blood work a fair amount in the past, but we've never really, I suppose, taken a dive of any depth into what your side of the industry is like and what makes it tick and why private healthcare, I suppose, is growing at the rate that it is. So yeah, this is a conversation I'm excited. I'm excited to share with the listeners and your audience as well. In any case, before we sort of dive into what makes a pathology service tick, would you mind introducing yourself, who you are, what you do, all that good stuff?
Yeah, my name is Sheryl Dunn. I am a biomedical scientist by trade and have been for quite a long time. Worked in the NHS and the private industry for 40 plus years, which is a bit scary nowadays. So started Nationwide Pathology in 2011, and I'm currently MD and laboratory director of that company. And it's an interesting industry to be in, definitely. It's exciting and I still enjoy it, and I know a lot of people look to retire at certain points in their life, but I've got no intention of doing that because it still really interests me, being able to deliver a pathology service to people who need it.
Yeah, no, you know what they say. You don't get old because you don't stop playing because you get old. You get old because you stop playing, and I think that rings true for any profession. I think the moment you retire, all the all the wheels fall off, don't they? And I think if you keep yourself going and going, then you're more likely to sort of age effectively, although that's probably a different conversation. What got you into biomedical science to begin with? What was your initial sort of call, I suppose, there?
So originally, I actually decided what I wanted to do when I was at school. Always loved science, lived in inner city Birmingham at the time when things financially weren't really available to me to go to university. My actual a family friend was what in those days a medical laboratory scientific officer in Wales, and she used to take me in the holidays to the lab, and I just was really interested in it. So at the age of 14, I wrote to all the hospitals and said, when I do my O-levels, can you give me a job? And the day my O-level results came out, I had some letters come through the post that said, would you like to come for an interview? So that's really how I started. I've never done anything different from that day. And I definitely formally chose the right career.
Fair enough. Well, I suppose that's quite fortuitous, one might say. Okay, so let's dive into it, and maybe a bit of an odd place to start talking to start off with. But how did you get nationwide off the ground? You mentioned you started the company in 2011. Now, color me curious, but I suppose how does one start a pathology lab? I mean, there are plenty of us who've got centrifuges, microscopes, and stains floating around sort of under the kitchen sink at home, or actually maybe that's just me actually come to think of it. But yeah, how did you sort of go from this private sector? I think you were in the NHS as well, to then getting nationwide off the ground. I reckon it's probably quite the endeavor to begin with, at least.
Yeah, definitely. As I say, I've always been really passionate. I worked in, managed a private lab for 20 years in Birmingham after the NHS. And when it's not your company, it wasn't going in the direction that I thought we could go in. And that's difficult when you're not your own boss. So there were lots of conversations, and a lot of people said to me, you should be doing this on your own. You've got some really good ideas. But financially, to set up a lab is very difficult. So as a family, we took a real risk. We basically put everything on the line and thought, if we're going to go for this and do the things that we want to do, then we'll do it. And really, I set up the lab with machinery from some companies that I'd been involved with over the years. They took a risk on what I believed in, and sat in a room with a load of equipment on my own and waited for the phone to ring. And that's really how it started. And we just went from strength to strength. I think I knew the industry very well, so I knew what people wanted. And we've developed into the company we are now. It's still very family run. We try to treat all our staff like it's a family environment. We haven't sold out to anyone. My husband and I are the sole directors, and we get excited about what we can deliver. We've moved. This is our third move, and hopefully our final move to the premises we're at now. And it is difficult. It's difficult whatever business you start up in. And I think you just have to really believe in what you're delivering to keep going. But, there are late nights, there are still late nights. People think, you have this fantastic life when you've got a business that is doing well. And actually the effort that goes in behind the scenes is a lot more than people realise. People who own in business don't have holidays. They might go on holidays. They ultimately think about work or do work constantly. And I'm happy with that. So I think we're doing the right thing. And I get great enjoyment in seeing the people we help through offering the service that we offer.
Yeah, no, I think your first business is always about fundamentally learning business as much as it is sort of delivering the product. Just to speak to what you've just said, and yeah, it's a labor of love at the end of the day. You can't sort of go into entrepreneurship and expect it to be easy. And as you've no doubt sort of picked up along the way, it's I think business is fundamentally the game of solving both your problems and other people's problems as they arrive and as they arise. And it's kind of a combination of creating a really good product and a really good service, figuring out how to sell it, and then putting out fires on the back end. Um, in any case, when you sort of in the early days, were you sort of were you doing most of the analytical chem? Were you running the labs and all of that side of it?
Yeah, so I did all of the testing in the beginning, and all of the admin work. And, eventually, as we got busier and busier, we brought people in to help with those sides of it. Obviously, you need someone to answer the phone or input results. And so we just grew organically, really, customer-wise and staff-wise. And we've got some staff that have been with us for nearly the duration of that time. And it helps that I was on the ground. I know how it started, and I can do everything that I expect everyone else to do now. And we've got children involved who are now part of the business, and they all work their way up from the bottom. So we all sort of learn everything. So you know how long something takes, and you know what you're expecting somebody to do.
Yeah, no, that's amazing, and I can just speak to the quality of the staff that you have. Not that this is an ad, especially, but you really do have amazing staff. You mentioned recently that you've moved again. Is this sort of a final, and that being a final move? Is that just sort of from a point of expansion? Have you got new units in? Is that the sort of the reason for the move, or?
So basically, we've outgrown 2 labs into, and an opportunity came up actually where we live at the moment, where there was an empty barn. And to make life easier, we thought, well, we might as well convert this building into a purpose-built lab, which meant that we could have windows where we wanted them, and we could look after our staff better, give them a better environment. It was also 4 times the size of the lab we moved from, the space. And we thought we'd have loads of room, but actually 9 months later, it's absolutely jam-packed. We might be looking for more space, but I think it is a permanent site where we are. We're in an ideal location, right in the middle of the country, M1, M6 corridor. We've got a train line to London that's 55 minutes. So we're well sat, actually, that we don't get those snarl-ups of samples trying to get to us, even though we're not in London or not in big city. It works really well for us.
Fair enough. Yeah, I suppose having a background in biomedical science has definitely helped you. Do you think that that training sort of, I suppose, really, I suppose it did actually help you get established? Is this something that someone would, without your background, could potentially get into as well, setting up a pathology lab? Or do you think you need that technical experience if you maybe don't have a partner, a technical partner off the bat to help?
I think you definitely do need technical experience in the field, whether that's you employ somebody to do that part of it or not. But I think it helps. I think there are some labs that set up in COVID, and COVID was one
Yeah.
test, and that's one test, one lot of quality control, one lot of results that can possibly go wrong, or there's issues with it. When you're actually into the realms of having a private pathology lab, there are hundreds of tests you are doing
Yeah, of
every
course.
day, and that's a lot different to doing one test. And I think people found that in COVID, they set up labs to just do COVID testing, and then thought, oh, we'll delve into this market. And I think some of them have struggled a little bit with that concept. One, because there's a lot of machinery you need to do these tests, which is expensive. You have to have partners that are ready to put that amount of equipment, and you've got to have the work and volume as well to cover those costs. And the quality side is very difficult as well. It's expensive and it's very laborious and it's very technical. So you need somebody very experienced to be able to help you with that quality side of it and your UKAS accreditation.
Yeah, no, that's a perfect segue actually, because the next thing I wanted to talk about was UCAS accreditation. But before we get there, though, you mentioned COVID. Maybe the last question I'll ask here, just regarding the sort of the startup here regarding Nationwide. But how did you move through COVID? Did it? I assume it had a positive effect on the business at that time and space.
Definitely, it was very difficult. We were all at the point where we didn't know what was going to happen. I personally thought this, we could all die from this flu. And, at the very beginning, it was very scary. And even though as labs do PCR testing and that is done, it wasn't used on a routine basis. So to be able to facilitate the amount of testing we did was quite challenging at the time. It was really exciting to be in that world of biomedical science at the time. We didn't know what was positive and what was negative necessarily. We did some of the first COVID testing. We obviously helped the NHS at points. We did, by the end of COVID, we were doing 15,000 COVID tests a day and sending 15,000 kits out. So it was a big learning curve, but we had to think on the hoof. There were lots of talks with the government and other scientists about how we approach it. Financially, it was obviously very good for the labs that did big testing, and that's probably allowed us to reinvest into a lot more testing post-COVID, which is the exciting bit because, as I said before, to bring new tests they're expensive bits of machinery, and you need the capital behind you to be able to facilitate that testing.
Well, there's always a silver lining, not Harvard. So, in any case, okay. So, working in the supplement industry, which is sort of the background over here behind the podcast, I'm fairly familiar with testing of various sorts, and I know if you want your products to stand out in the market, and to have any chance of being taken seriously, they need to be tested by a UKAS accredited lab, something you mentioned earlier. Now, obviously, a different sort of testing, but for the audience, would you mind breaking down what UKAS accreditation is, and then maybe why it's important to have that as a lab?
UKAS accreditation probably underpins the quality of results you are delivering. It's changed over the years, UKAS accreditation. Some years ago, it used to be called something else, and they accredited a lab, whereas now UKAS accreditation is on each individual test. So they come in and they inspect us, but they go through every part of the business, from recruitment to what you've got on your website to your terms and conditions, to then drilling down to each individual test. And those individual tests are assessed on a strict regime according to a accreditation schedule that you have to fulfil. But part of that is that we carry out internal quality control every day on any tests, and sometimes twice a day on tests we do, to make sure we're achieving a set result that we know from a known sample. And we also take part in external quality assurance. So it's a blind testing where you get samples sent to your lab, you test them, send them back, and then you're compared to your peers, really. So there are so many labs take part to do, for example, a hemoglobin test, and everyone's compared against each other. And also you're compared against methods, because every method or every different manufacturer has slightly different variables. So you can see whether you're achieving the same result as all the other Siemens users in the country. So internally, it's really good for quality, because you can see instantly if there's something going on with the test, and that might not be at lab level, that might be at manufacturer level if they're getting odd results or things aren't quite where they'd expect them to be. So we do that for every test we do. UKAS have to have specialist people who can inspect those particular tests, and that's quite challenging for them. It's a hard job for them to get around all these labs and inspect all of the tests that they're doing. And that's why sometimes the schedule of accreditation for labs doesn't cover every test, because sometimes it can take you 2 years to get a test on that schedule, which is quite challenging. But it's because we've got that medical level of UKAS accreditation in our lab, it underpins to our clients that actually we follow the same protocols for all of the tests we're doing in-house, and we follow the same procedures. So it gives them reassurance that we are doing everything to the best of our ability of that sample. And obviously it's difficult. We're not a hospital, so we haven't got patients on boards for us. Our work comes in by couriers or post. So you don't always know what's happened to that sample, wherever it is. It can be taken anywhere in the country. But we do our best to be able to say, right, on that sample, on that day, this is the test result we've achieved, and we've got all this underlying quality control that we've put in place to say that that's what we've achieved on that sample.
Yeah. No, I mean, there is some due diligence required by the customer, the physician, the phlebotomist, etc., to make sure that samples and specimens are sort of obviously labeled accordingly, so you can then sort of make a calculated decision on whether that sample is still viable when it arrives at the lab. But I think ultimately what this accreditation seems to provide is just consistency with regards to test specificity and sensitivity across just all, as you mentioned, labs and machines and units. And so I mean, that's the fact that you've got it obviously just speaks volumes to the type of service that you're running. So that's incredible. Um, Cheryl, I'd love to switch gears a bit, and then I suppose talk about maybe what makes Nationwide a little different from the norm. Now, starting off though, how's your lab set up in terms of equipment? I reckon you've probably got a little more than I do stored under the kitchen sink and in the broom closet.
Yes, definitely. We've got a massive amount of equipment. We try and do as much as we can in house, and if we don't,
Hmm.
if we've got a demand for it, we get some equipment in that we can do those tests on. Obviously, every test is done on different equipment. Our core equipment is Siemens Atelica analyzers, and we do our routine biochemistry, our immunology on those mainline machines. That's quite an automated system. We've got a new bit of equipment, which is a track system that joins all those analyzers together, which makes us more efficient. But there are lots of companies that give us, that we've got equipment for in the lab. We've got LCMS, we've got PCR machines, we've got electrophoresis machines, hematology analyzers, and certain analyzers do different things. So we've got an Imulite that we've run allergy testing on. We also do IgE and IgG allergy. So yes, there's a lot of equipment, and hopefully our website will be updated soon and people will see the pictures of the new lab and see actually what it looks like inside a lab.
Fair enough. And I suppose all your machines are constantly calibrated to sort of account for drift within your sort of your mass spec machines and things like that as well.
So everything is calibrated, everything is quality controlled every day, and sometimes twice a day. So sometimes we do the morning, then we do an afternoon quality control run on our most common tests.
Okay, no, that's impressive to say the least. And to be honest, sounds like my idea of heaven. Maybe a bit of a technical question, but are you doing any sort of ultra sensitive hormone testing using sort of LCM, SMS, anything like that? Obviously, you get different sort of assays or test types for the audience looking at hormones. Maybe as an example, you get ultra sensitive estradiol, for example, versus just an immune based assay. Are you looking at these are you offering these ultra sensitive tests yet, or are they more just sort of run of the mill?
We will be. We've just invested in our CMS because we recognise that hormones, testosterone and estradiols are much more accurate on our CMS, and that's something we've just put in, and will be launching in the next month also to offer our menopause clinics and our testosterone replacement therapy clinics a more accurate way of testing for those hormones. And that's something that I'm really interested in at the moment.
Oh, awesome. That's music to my ears because, yeah, working with the odd client and, yeah, the moment they're on any form of HRT, obviously those sort of, yeah, let's call them traditional sort of tests tend to be less reliable. So I'm really glad to hear that because, yeah, that is definitely a USP. I can't think of many labs who offer that. So that's exciting to hear. Right. So recently, I went to my GP to get some bloods run, and believe it or not, I actually managed to get them to run serum copper, which surprised me. Normally, that's a bit of a juggling act, and yeah, I got cross questioned for an hour beforehand. But yeah, all came back except the copper, which I was told would take a few weeks to get done. Uh, that kind of stumped me, to be a bit honest. I must admit, as I believe, you correct me if I'm wrong. I think most minerals are just sort of analyzed through atomic absorption spectroscopy. Again, I'm probably just very naive here, but that strikes me as a bit strange that as sort of a government-based institution doesn't have sort of regular access to this sort of kit. Anyway, I suppose an actual question, which sort of goes back to one I asked previously. How does a private lab like yours differ from a traditional NHS setup? And yeah, what you've already discussed are, well, I've mentioned are likely fairly limited.
I think NHS pathways are different, and I think you've encountered that when you go to GP and you want a particular test that isn't in an NHS pathway or you don't fit the criteria for that test. So a lot of NHS labs don't have that specialised testing and they'll often use referral labs for that. How we differ is we try to offer all of that under one roof. So we will do vitamins and minerals on a sample. We send very little work out, and we like to keep control of our samples. So, for example, if you go to a doctor and you ask for, they suspect you've got a thyroid issue, they might just send it off for a TSH because that's all they're allowed to do. Whereas we will do a whole thyroid panel, which actually gives a better picture. And if there is a result that is different, then the GP or the private doctor has that in front of them straight away instead of sending the patient back for another blood test. So we try to do more comprehensive testing that gives a bigger picture, I think. And in order to be able to do that, as a private lab, you have to have that testing equipment in-house and you don't question what you're being requested to do. So I wouldn't decide whether it's relevant, clinically relevant to do certain tests on a sample that comes into us, whereas NHS labs have to ask that question, why are we doing this test on this patient that's costing the NHS money?
Yeah, no, I suppose that's a bigger issue potentially talking about NHS guidelines and why they will and won't do certain tests. But I think, yeah, thyroid testing is completely it's a mess. I mean, I'm sure you can speak to this too, but looking at someone's TSH and just sort of hoping that you'll cover all bases just by looking at one signaling molecule is definitely not enough. And I suppose that sort of speaks to a reason why an individual should look to go private with testing to begin with, especially if there's maybe a bit more of a complex medical condition or they are struggling to get the answers that they need out of their GP. Hopefully, something we can come back to a little later on in the conversation. Um, anyway, last time I checked, which was when I had some caffeine in me, we're in 2025, and we are slowly, well, not slowly actually, we're fast moving into this sort of area of everything artificial intelligence. Now there are various companies popping out the woodwork here that are starting to sort of amalgamate sort of, I suppose, quote unquote traditional testing with AI. The Clearly scan in the States being a perfect example of this, which is starting to utilize CT angiography along with these AI engines to create results that look at calcium deposits in the body with far more accuracy than maybe just CT angiography by itself or traditional calcium CAC score, something like that. Um, have you thought about AI at all? And are you looking to sort of potentially integrate it into your services yet? Or is that something that's maybe a couple of years down the line for you guys?
I think for me, it's about the testing we do and the quality of testing to do. I think the interpretation of it may come in. I'm not 100% confident it will work for everybody, and that's the risk. I think it is knowing it's probably someone younger than me that will look into that and say, actually, this is going to come in. And I know there are companies out there experimenting with it. I don't know how that evolves when you're sat in front of a patient, whether people have done comparisons of what something AI would clinically diagnose compared to a normal doctor. And I think we just need to it is out there and it will come, but where we are with it at the moment, I don't know. For me, the important bit is us getting the latest technology and the best test results we can out there to enable somebody to be able to do a diagnosis on a patient.
On the back end, yeah. So I suppose it's a case of it ain't broke, don't fix it, really. Um, Fair enough. Well, of course, it's as you mentioned it's the future, and it's something I'm definitely excited to see develop. Um, in any case, I'd like to pivot again into something else that maybe I'm a little more clued up on, and that's the preventative care side of the equation. Now, part of what I do with the clients that I work with is obviously has a lot to do with testing. Now, in the past, I've tried to work with maybe clients, PCP, their primary care physician, to help them keep the costs down and get the testing done like that. But it's never worked. It's always painful. It's back and forth. And now I rely predominantly on labs such as yourselves. From your point of view, though, why do you think more people are looking to who are looking to optimize their health, are starting to turn to private labs and to help them keep track of the testing that they're choosing to run?
I think people are more aware of their health in general now. And I think COVID has taught the general public that actually there is a lab out there and there is access to private testing. I think that's changed a lot. I think telemedicine is important. People don't have to go somewhere to do it. But the NHS is fantastic and it does what it does for acute care really well. We all want to be healthy. I think that is the way that we're all going. We all want to live longer. We all want to have better quality of life. And I think we're all more aware of our health and what we can do to help that process. And I think that's where the private pathology market will expand massively because people take supplements, they want to live longer, they're looking at things, they're looking at different biomarkers than you would in the NHS and monitoring their health, I think. And I think it's important that private labs offer that service because I don't necessarily think the NHS should offer that service. We're trying to get costs down, bring things in-house, and the more we do of that testing, the cheaper it will become because instead of doing one test, you're suddenly test kits tend to come in a batch of 100. So if you're doing one and it goes off in 30 days, you've incurred the whole cost of that test kit. If you could do 100, you're splitting that cost down. And what we do at Nationwide Pathology, we really try and pass that cost reduction on as soon as we've got demand or it's costing us less to do. Because there's no point offering a test that's going to cost £1,000 because no one's going to do it and it becomes inaccessible to people. But if you can offer something for 20 because you're doing volume of it, then it makes much more sense.
Oh, that makes perfect sense, and it's definitely a business model I can get behind, especially again when working with clients and sort of oftentimes you will try and get them to run a few different tests all at once, and yeah, those bills really do add up very quickly. So that's awesome to hear. So I suppose a lot of companies in the space have launched or are starting to sort of build out these direct to consumer models. This obviously has its pros and cons. I would have thought with your clinical support team that's maybe it's something that you would start to look at offering. I'd love to chat about your support team in a second, by the way. Is this sort of something that you're considering? This sort of this D2C a model, or are you primarily just still looking to work through practitioners?
We try and work through practitioners where we can. One of the reasons is we don't want to compete with our own customers. I know some labs are quite happy that they're offered to the general public. We did in COVID, obviously, because we had to offer to the public in COVID. I think it helps. I think there are a lot of private GPs and telemedicine companies that can help people and we can help facilitate that testing. But I really do like having that relationship with our GPs, and it might be physios, it might be people who work in the gym, but we like helping them provide a service to their customers or their group of people as well. It's not about individual consumer testing for us, because I think there are other platforms that do that quite well. Menopause and testosterone are classic examples of that. There are companies that have thousands of clients on their books, and we just deal with the GPs that run that, or the physios or other people. So I think where we can, we try to deal business to business rather than B2C.
Yeah, that makes complete sense. And I suppose it's kind of the old adage, you sort of stick to your wheelhouse, focus on what you do well, and then let everybody else sort of, I suppose, pick up the slack on the back end. Just out of interest, are you supporting any of these sort of platforms on the back end with their testing services?
Yeah, there's a lot of the online companies that we do the testing for, and we facilitate, which is different to a lot of other labs. We facilitate phlebotomy, which was a big hole in the market. So if you're doing an online consultation and you need to go and have your blood taken, it was very difficult to find somewhere that can do that, and we facilitate that for all our customers. That's an add-on service we do. So we've got phlebotomy clinics all around the country that are CQC registered, and we have patients phone us from that are referred by their clinics, and we put their postcode on and try and facilitate that phlebotomy, whether that's with a clinic-based phlebotomy or whether it's a mobile service. So we've worked very hard since we first began really on offering a phlebotomy service across the country. We've streamlined that, and I think that's a very good add-on for our customers. And a lot of people use this because we offer that service and we do it very well.
Yeah, no, you definitely do. And again, I mean, it's something I've used as well with the clients I work with. And it is required because unlike, yeah, I suppose I'm the exception to the rule, but very few people are willing to phlebotomize themselves like I am. So it's a case of do as I say and as I do, of course, but needs must sometimes, some needs must occasionally. So yeah, no, I'm thrilled it's a service that you offer. Okay, the other thing that you do really well is you've got this sort of back-end clinical support structure that does help when helping to interpret results. How did and when did that sort of develop? Was that sort of something that was sort of introduced straight off the bat, or has that something you've introduced over the years to sort of help? Well, I suppose the the practitioners you work with and the odd sort of direct consumer client to understand the labs that they're trying to run and interpret?
Yeah, I mean, I think it's evolved. It was always there from the beginning, but on a very small scale. UKAS 15189 accreditation is a medical accreditation, so it does require you to have consultant backup for clinical advice. We've got three, that's part of the standard for that accreditation. So it means that we can give advice, we can interpret some results, we can say whether you've got a current infection or we assume you've got a past infection based on the results we get, but also for in-depth things, especially for microbiology and some infectious disease results. We've got consultant backup that can talk to our GPs and reassure them or suggest further testing that they may need, and that's an important part now. As we discussed earlier, there are more and more people using private pathology labs. Obviously in hospital we have instant access to doctors, but I think it's something that we are proud of, that we can offer that service to all our clients. And it's really important because it gives them reassurance in certain cases that they can pick up the phone and speak to people. And what we also do is, as I say, we don't operate a call centre as such. We're actual people, and people have access to me and director level at any time, night or day, to speak to us if they're unsure about what testing they should be doing, whether they're unsure about results. And I think that's very different. It makes us unique, really. in the laboratory world, and I think that's something we've been very precious about keeping, that we are a very bespoke, tailor-made service for our clients. And I think we can do that well, probably because we don't sell to the general public as well, because we're not overloading with individual cases. We can still deal with those individual cases, but we're doing them through one forum rather than each individual person.
Yeah, no, that just speaks volumes again to this type of service that you're offering, and I think it does ultimately just result in better patient outcomes too, because you have multiple sorts of points of interpretation on the test, and then you can sort of come to a sort of a common consensus as to maybe what the issue is, and instead of maybe a misinterpretation on the physician's part if they maybe don't understand the nuances of that specific lab. So I think that is, well, I know that's really helpful. In any case, Cheryl, you've been amazing, and I know we're starting to run up on time. Would you be open to just running through a few sort of rapid-ish fire questions, a lightning round, as you might say? They're never that rapid, but yeah, sort of just some nice questions to end off with.
Yeah, that's fine.
Cool, awesome. Okay. Test in your opinion that you reckon everybody should run maybe on a quarterly to a yearly basis.
Definitely hemoglobin A1Cs to pick up pre-diabetics. That is a big thing. That can actually be reversed really easily if it's caught early. Thyroid function, I think, is really important to test. I mean, your general well man, well woman checks, there are lots of diseases that can be addressed fairly simply that might not pick up, and GPs don't do that preventative well man, well woman check every year. If you're under a certain age as well, we've picked up things actually on the lab team when we've wanted to validate tests or use people as controls, and we've picked up definitely thyroid issues, autoimmune type diseases that as now people have been treated as giving them a better quality of life. I think it's really important to test and really important to trend as well. So what might be normal for you might alter slightly, but might still be in that normal range. Those normal ranges are for 90% of the population, but your normal range might be slightly different. Your testosterone might run at a certain level, and that might be normal for everyone else, but if that drops but still in a normal range, then that affects your lifestyle or your well-being. So I think it is important to check annually, 6 monthly annually, for that. And that's what we do for our sports clients as well. We're really involved in sports medicine, and it's really important for them, the elite athletes, to have regular testing because they are pushed to the extremes of their bodily limits. So we do a lot of trending for our sports clubs as well.
By trending, you mean?
Trending, so we compare results over time.
Oh, okay. All right, got you. And what sort of markers, generally speaking, there are you looking at for sort of professional sports teams? I assume it's a lot of hormones, a lot of liver enzymes, a lot of inflammation markers, obviously keeping an eye on those metabolic parameters you spoke on earlier. Is it just sort of an extension of the sort of the well man, well woman tests, or are you looking for something sort of ultra specific with those tests?
We do. I think sports medicine actually has gone down the route of nutrition, and it's very important to them. And they obviously have supplements for certain things. They have to be, certain biomarkers have to be higher levels in elite athletes because their bodies are under such extreme pressure. And also they get ill. They're ill like any of us. Some of these sports players, there's a lot of glandular fever, those sort of things. So there's a lot of testing in sports, and I think they tailor-make their nutrition as well, depending on the biomarkers they get. Their vitamin Ds are at a certain level, their ferritin level has to be a certain level. We test copper and zincs in a lot of sports players. We test a lot of vitamins as well, which is really interesting. So the sports side of it is very specific. And on our, we offer a trending platform as well that we call with regular blood tests can actually look at their results over time, which is interesting in case it impacts performance.
Yeah, no, that's impressive, and I sort of love the fact that you brought up nutrients. I think that aside from the sort of the metabolic markers, nutrients are one of the most overlooked markers or biomarkers that people should be checking. Bit of a selfish question, maybe. Are you looking at sort of whole serum nutrients, or do you do red blood cell as well, sort of across the range?
Yeah, we do both depending on what the client wants. So we can do red cell or serum.
Okay, perfect. Well, that was not a rapid fire question. Hopefully, the next one will be. No, that was completely my fault. I just went off on tangents. Yeah, get me going, and we'll be here till Christmas. Okay, next one, and I'll try not to interrupt too much, but I'll probably fail miserably. What's the biggest myth about private blood testing?
Oh, the myth that it's expensive. I think people think it's not reachable, and it definitely is, and it's got more that way. As I highlighted before, we are not afraid at Nationwide Pathology of bringing test prices down. If I can bring it in the house and do it cheaper, I'd much rather do that with a quicker turnaround, a cheaper test, which makes it accessible to people who wouldn't think that they had access to that.
To start with, yeah. Okay, a follow up on that one. How can patients save money on private testing?
I think if they went to reputable private GPs, I think Dr. Google isn't an ideal thing because you can put lots of things into Google that bring up very, very expensive tests. Whereas if they go to somebody, not necessarily a private GP, but somebody who's experienced in nutrition or physios or some people who are really interested in that, I think then they can direct them to testing that is relevant and not overly expensive. Obviously, some of these tests that appear in the papers every Sunday are actually research-only tests and are done at some university in America, and they're actually not available. But I think there's a lot of people out there that can direct people to cost-effective private testing.
Yeah, I think there's definitely an element of Dunning-Kruger, that sort of cognitive bias where people with maybe a low competence in a specific area tend to sort of overestimate their ability or knowledge in that domain. And then they get onto Google, and then all of a sudden they sort of just go wild on a D2C platform and sort of rake up a 3,000 quid bill when in reality, all they need to do is check a few simple markers. So yeah, that's definitely those are definitely sage words of advice.
And I think as well, what is relevant is sometimes people want a lot of testing, and if they go to some of our clients, if they send that to us, individual testing, you have to have an individual price for a test. But if you're doing a big group of biomarkers, we can offer different profiles and more cost-effective profiles, and we can actually group those together. And we have actually launched for a lot of our clients some tired all the time profiles and some well man, some well woman. That if you go on a platform and request each of those tests individually, it becomes hundreds of pounds. When actually we can do it, make a much more cost-effective way of doing some set profiles. So that's how we like to work. We like to be able to offer people the best price for the most comprehensive testing that we can with the quickest time.
That sort of economy of scales thing, the sort of starts ranking up in your favor as the consumer. Okay, next one. What do you find is the biggest trend in private healthcare at the moment?
Hard to say. I think hormone testing is very big. I think testosterone will be the next big market. We are obviously, women's menopause clinics are very well known now, and they're very publicised and people know about them. I think there is a myth behind, men saying they have a problem, and I think generally as a lab we have seen men's testosterone results drop dramatically over the last few years, and I think really that is, if we can get rid of the kudos of men having low testosterones and make men talk about it more, or symptoms, then I definitely think that is something we should be testing.
Yeah. No, that's interesting. I would have said longevity. I think that's possibly the next burgeoning market as well. I think a lot of people are starting to become very sort of aware of their mortality and that there's something you can do about it. And obviously there are a lot of markers associated, quote unquote, with one's longevity that can be where there's data that can be extrapolated and there's data that can be extrapolated from those tests. But no, I mean that's an interesting take for sure. And I suppose the last question of the day: where do you think the private healthcare system is headed in the UK?
I think more and more people will use private healthcare. One, because the NHS is overstretched, and also there are lots of new tests and new things we're finding out. We're all learning. There's a lot in cancer care and tests we can do for that. Preventative or recognising cancer before it actually becomes symptomatic. And I think the private market is in that field at the moment. But also, I just think, as you say, people are looking at longevity and are more aware of the health. And I definitely think that middle-aged group and the younger person now wants to know if there's anything they can do and whether losing weight affects whether you become type 2 diabetic in the future. And I think none of us want to sit at home and not do anything. We're not 60 now and sit in a chair and never go out or do anything. We're all fit and active and we all want to carry on and live forever, really. So the more we can do and the more accessible private healthcare is, the better for us all, I think. And it will help the NHS in the long term that we're not sat in hospital with some of the problems that we perhaps could have solved before then.
Yeah, it's all about prevention at the end of the day. Cheryl, you've been a star and a treasure. Where is the best place to point people should they want to learn more about the work you do nationwide? And where can they maybe connect with you online? What's your preferred social platform? All that good stuff.
I think LinkedIn is our most up-to-date platform. We've got a really good page on there. We put new things all the time, new tests we're doing, we're bringing in-house, our turnaround time. Our website is being updated at the moment, but they can go to our website and they can just call us anytime, and we're open 6 days a week till 10 in the evening from 7:30 in the morning, and our team are on hand to answer any questions or help anybody with any questions that they want to ask.
Perfect. And that website URL being nationwide pathology.co.uk, is that correct?
That's correct. Yeah.
Perfect. Awesome. Well, thank you very much for your time. This has been an amazing conversation, and hopefully we can do another one at some point in the future.
Okay, that'd be really good. Thank you, Rob.